Well, good morning, everyone, and welcome to this month's Advocacy update. We appreciate you joining us. I'm Stephanie Bucher, and I'm the Communications Director for the Ohio Suicide Prevention Foundation. We will have some time after the presentation from Tony and Daniel to answer any questions that you may have. So please use the Q&A feature, and we will try to get through as many as possible in the half hour time that we have today. As I mentioned, we are joined today by Tony Coder, who is our CEO, and Daniel Bennett, our Chief Strategy Officer. Gentlemen, thanks so much. And if you would like to begin, we will get started.
Perfect. Thank you. So I'm going to start off talking first about a federal bill that came to our attention recently. It's House Resolution 1041, or the Veterans Second Amendment Protection Act. We actually got some outreach from a federal legislator who had some concerns that this could potentially increase risk of suicide for our veteran population when it comes to access to firearms. So, in a nutshell, kind of what the bill covers is it changes how the VA reports to the background check system. That when you or I would go into a firearms retailer to purchase a gun, that's the system that they use to see if there's anything that would stop us from purchasing, like a felony arrest, or if we've been admitted to the hospital for certain periods of time for mental health issues or things like that. So when they reached out, the concern was again that this would increase access to firearms for veterans who potentially were at risk. Kind of doing a little bit of digging into it, it actually puts veterans at the same standard as it does the general public. So it kind of aligns veteran reporting with what civilians see. And kind of what it covers is if a veteran is seeing the VA for because they have a fiduciary for financial help, that wouldn't get reported into the system. So now the VA can still report somebody in if they've been admitted to the hospital for an extensive period of time, if they have been found to experience a mental health concern that would prohibit them from firearms. The VA can still report that, but they just won't make reports into the federal system for financial issues related to the veteran. So we do know that our veteran population does have a higher rate of suicide than the general population, and we do know that access to firearms when somebody's in crisis can increase risk for suicide. But nothing in the bill here was especially kind of stood out that it would increase veteran risk for suicide. But we did want to make sure that folks knew that this bill was out there as we were getting some calls and some questions on it. We also wanted to give an update on some of the bills that we've been recently tracking. We mentioned at the last legislative meeting that we were paying attention to House Bill 831 around PANS and PANDAS. And if you're not familiar with PANS and PANDAS, that is where an individual can develop some behavioral health symptoms and even potentially suicidal thoughts after experiencing a viral infection such as strep throat. We met with Representative Jack Daniels' office last week to share our support for this. This bill would allow or require insurance companies to cover care and testing for PANS and PANDAS, and also would require that they don't use step-up care approaches, that they use the care approach that's going to be most likely to have an impact and reduce risk for suicide there for that individual and get them the treatment they need as quickly as possible. So we just wanted to report out we had met with Representative Daniels' office, and we're really excited to see if this bill can move forward as the legislature continues. We have an update on Senate Bill 273, the Keep Them Safe Act, which we've been tracking for some time. Excuse me. It was voted out of the Public Safety Committee in the House. It got all favorable votes there. It is now moved to the Rules and Reference Committee in the House, and they're actually meeting on it potentially right now. The meeting started at 10 a.m. and there were only three bills on there, so they may be discussing this right now. We are hopeful it'll get voted out of Rules and Reference Committee today and then can go to the full House for a vote. When it was in the Public Safety Committee, there was one minor amendment to it, but it was just kind of changing some language around who lawfully owns that firearm. It didn't change anything regarding the bill itself. We also reported recently on the medical aid and dying bill, House Bill 835. Tony and I met with Representative Sennenberg personally in his office, and we had shared the last time we met OSPF's stance and our kind of our public statement when it comes to bills similar to this. But we did want to report out that when we met with Representative Sennenberg, he was very open to the discussion. And even though it's not a bill that we could be in support of, he was happy to have some of those conversations with us, and he offered to connect us with some of the folks that are in support of this bill so we could share our concerns from a suicide prevention perspective. And I really wanted to highlight that even if you don't necessarily agree on a bill with a legislator, it's still appropriate to make those connections and have those conversations. They are willing to listen to your concerns. And in some cases, they may even make some changes or may update a bill to there may be times where there are things that they didn't think about that go into a bill, and they're certainly interested in the perspective of their constituents. So, really happy to report that that meeting went really well, and Tony and I were there for almost an hour, so it was a really good conversation. And then we also wanted to share out, we haven't reported on this one yet, but House Bill 709, which would require private insurers to cover telehealth mental health services. This is a bill that's been put forth by Representative Meredith Craig and Representative Brownlee. And so it's a bipartisan bill. For that bill, the kind of the impetus behind this one is that we wanted to, or they want to open up mental health services and make them more available to especially our farmers and our rural communities that may not always have access quickly to mental health services and may have some barriers around their work schedule and their ability to drive and access care. So this would require that private insurers would have to cover mental health services if they are offering mental health services in person. So if they're not offering those in-person services as part of their care, it doesn't add the telehealth. It just would put telehealth as kind of even with in-person services to make sure that folks have access to those. Tony, anything you wanted to touch on these bills?
Yeah, right now over at the State House, it's quite chaotic. There's a lot, this is probably going to be the last week. This or next week are going to be the last weeks that they're going to be in session. And so they're trying to pass an awful lot of things. I was talking to a lobbyist this morning, and they were trying to combine bills. They're trying to add create a couple of Christmas tree type of bills, which are basically bills that include an awful lot of things in one bill. Senate Bill 273 has actually got a little bit added about creating some things around security for the gubernatorial candidates. They're going to add that to Senate Bill 273. So they're going to try to do an awful lot. And then you have which I'll talk about in a little bit. You kind of got the big Medicaid reform piece that is a big topic down here. And again, I will chat about that. We got a slide for that later. But this is really, really busy. Last night I was contacted to testify today, and was not able to do it. But it just a lot of things going on right now. So, but in 2 weeks, they will be back in district again. Like we say every time, reach out to your representative, reach out to your senator, introduce, if you haven't introduced yourself, tell them what's going on, because more than ever, we're going to need voices to make sure that, especially with the next budget a year away, that we're going to need champions out there within the legislature. So that's what I have. Thank you. So we have been partnering with a group from Minnesota called SAVE. They're a national organization that does suicide prevention work. And we have been working together on some of the AI webinars that we have. The next one is actually tomorrow at 1 p.m. Um, and and some other social media pieces. There was this group and we and some other national groups had come together to hold a press event near the Capitol building. We had parents who have been impacted by technology, and we wanted to create, as opposed to having individual events, we wanted to create a movement, much like MAD, much like, when HIV was an issue back in the 80s and 90s. There was a national movement to get work done and to get some, real reforms and real solutions, as opposed to one-off events. So we want to create this, and in fact, flying later this week to meet with some folks about making this more of a solid piece. But we want to create this group to address person-based considerations with AI and technology versus just the concerns of technology. A lot of times in our state house at the federal level, we get a lot of conversation about, well, how's this going to impact technology moving forward? How's this going to impact the profits of, we don't want to put small business or big business out of business. And we can do all that, but we also have to make sure we can support business, but at the same time, let's have some considerations for folks who are utilizing these different platforms. So we're recruiting parents and loved ones who have had family members mental health impacted by social media, AI, and technology. And in mid-September, we're going to be hosting another press conference near Congress to introduce the Parents Over Profits nationally. And if there is someone from your area, if you're a person who has had a loved one who, or you yourself, who's been impacted by social media, and your mental health's been compromised, then let's we would love to hear from you, because in my opinion, the only thing that um, ever got drunk driving laws changed in this country was a bunch of really, really upset moms that formed Mothers Against Drunk Driving. And the only way that we're going to have a voice in this is by all of us kind of sticking together, not necessarily, having some common talking points, but we don't have to believe the same way, but we do have to, have some kind of partnership on this issue. So we want to do that, like I said, in mid-September, which is Suicide Prevention Month, and introduce this issue of parents over profits, and helping legislators understand that technology also needs to be concerned with people and not just with profits.
Another thing we wanted to highlight is that Tony and I will be having a conversation later this month with some additional prevention agencies from around the state, and just kind of talking about how we do a better job of advocating for the field of prevention itself. If you are in prevention, you probably have a good understanding of the work we do. And if you're outside of prevention, you probably maybe don't necessarily know what prevention science looks like. Or to you, prevention is like, if you're the general public, like fall prevention, or we might talk about drunk driving prevention, as Tony just mentioned, with some of those national organizations. So we really want to make sure that we're making kind of a unified case and conversation around what prevention is and how it's actually supporting the behavioral health system in Ohio, and how it's saving not only lives and families, but also saving money. Because we know that for some of our legislators, that's going to be the piece that really moves the needle for them, is those conversations financially around what prevention can do. So we are meeting with some of those folks from those additional prevention agencies. Our end goal is here is that we're going to create some materials that can be distributed to legislators. We are planning in February to host our legislative advocacy day again, so we will be calling on folks to join us there. But before we get to that point, we need to be ready to have those conversations. So we need to really think about how we share this story around prevention and put it into a framework, and we story tell in a way that resonates with legislators. There's a QR code there. We're asking for folks who are on today's call, if you can scan the QR code and just take a minute or two. It's literally one question. Just kind of tell us what you would want shared about prevention, how you would make that message meaningful to legislators. We will take that and kind of combine it into some of this work as we're kind of crafting this message. So if
Well,
you could take a moment, scan that, we'd appreciate your input.
Well, and also with gubernatorial candidates, I know that we have been meeting with, they've actually, it's been good conversations on both sides, whether you're Republican, whether you're Democrat. They have been listening, and this is but they neither of them, their campaigns understand a whole lot about prevention. So this is an opportunity for us to also help drive our message, prevention message, with the gubernatorial candidates. So, they can have a little bit of education before whoever gets into office. And again, this would be a great way to introduce ourselves, to make something simple. There was a line back in the movie Philadelphia a long time ago that Denzel Washington's character always said, tell me like I'm a 6 year old. And so if we can break it down into simple terms and help them understand, why prevention is important, why it's cost effective, what the benefits are, and we have a lot better chance of being a part of the solution as opposed to, let's just cut prevention like it is sometimes during budget time. So, please feed us what you would like us to remember and to say. And obviously, when we get together with some of these other statewide prevention groups, that we have this data that you're going to share with us, and then we'll be able to make a best product and then share it out with you, so we can also all talk from a common voice. So, one of the biggest topics down here in Columbus, or up here if you're in Southern Ohio, is the Enact Shield Act. There has been a lot of news around Medicaid fraud and what's happening with Medicaid. I know that the presidential administration and some of their officials came to Ohio, I think, last week to discuss with our state officials about Medicaid fraud, and there's an extra emphasis on this. So there was a bill, House Bill 795, which was introduced by Representative Josh Williams from up in the Toledo area, and it basically is to battle Medicaid fraud. Um, this is a very, very controversial bill. It would have eliminated financial support for family caregivers who are taking care of loved ones, which quite frankly I think uh, was a big mistake. Um, they it would have actually probably created more cost, because if family caregivers were not paid to take care of their children or their loved ones or brothers or you know whoever, then it would those folks would have to be institutionalized, and it would been a lot more expensive. So there's been some hearings on that. Ohio would have been the first state to have had this removed. However, this clause was actually removed on 6/8, so yesterday, in Sub Bill 795. So that has been taken out, that elimination of financial support for family caregivers. And this really does show there were hundreds of folks who would have been impacted that brought their loved ones down, who have some pretty severe disabilities. It was not an easy task to get to Columbus to testify on this bill, and legislators listened. It was really a lesson to all of us that the voice still lies with the people, no matter whether we think we have it or not. If there's enough of a voice, then that voice is going to be heard, and that was taken out. Now there's still some issues in this bill that opponents are really um, uh, vocal about. Most opponents are family members who have children with disabilities, providers, others who would be impacted. Um, One of the big pieces is GPS monitoring being a key point of contention. That basically there would be some requirement about the caregiver being monitored by a GPS system. And so one of the parents yesterday was talking about, so if I take my child to on a walk to get some fresh air, that's not going to be considered supporting that child's needs. And also you talk about the privacy issues and all kinds of other things. Um, One of the other pieces was about prior authorizations. That treatment would have to have prior authorization before before the service is allowed. And I was talking to a mom last night who lost her daughter a number of years ago, and she was waiting for a prior authorization to have her daughter uh, put in a mental health facility, and before that could happen, it was I think she said 6 weeks. Her daughter did die by suicide. So, prior authorization is going to slow a lot of stuff down, especially folks who, might be in crisis mode. So, that's another point of contention I think we have to really worry about with this bill. We don't do a whole lot with Medicaid. Prevention is not a service that is funded through Medicaid. So, but if we have to be about the entire system. So treatment providers, if we don't have folks who can provide treatment, they're definitely going to be impacted. Therapists for after a suicide, it's just going to be it's going to be a challenge to make this work. Some of the pieces of this. So this is the big issue that's happening down here at the State House, and something I think we're monitoring. But if there are examples, I would reach out. That you experience, I would reach out to your legislator and let them know what your concerns and what your thoughts are on this. It's a very large bill, so it'll take you some time to read this thing, but it is out there and is being debated right now. And and as I said yesterday, earlier, that tomorrow at 1 o'clock we have our AI and suicide prevention intersection webinar, and we're going to have this is going to be based on AI in the courts. We're going to have the attorney who oversees a lot of the court cases. He works with families across the country on folks on people who have been impacted by suicide through AI, and we're also going to have a family member who has been impacted. In addition, we'll have an update from the federal side, what's going on with the AI framework that the president wants to be created at the federal level. And then we'll also have Dr. Marlon Wee, and she is a psychiatrist and an author who studies AI and impact, both positive and negative. on suicide and mental health, and she will be presenting as well. So it should be a really, really good lineup, and it's free. So we would love to have you join us tomorrow.
Okay. Tony and Daniel, thank you so much. All right, so if you have a question, anything that we've talked about today about advocacy, please go ahead and put that in the Q&A. We just have a few more minutes that we can get through some questions. One question that has been posed regarding Senate Bill 273. And the question is, has there been any collaboration that we're aware of here at OSPF with the Armory Project? And if you're aware of that particular group.
Yes. So there was some collaboration when the bill was originally being drafted. Our the gun shop that kind of was the driving factor behind this reached out to the Armory Project and a number of other entities that are doing some similar work around the country. And some of the language that was written in Senate Bill 273 originally was very similar to the bill that Armory Project got pushed through in Alabama. So definitely a lot of parallels there. Since the legislation's been proposed and got through the Senate side, I actually met with one of the two representatives who run the Armory Project. We've talked about some of the resources they offer for when Senate Bill 273 passes that Ohio could either piggyback off of or kind of make our own. And they're very graciously willing to let us either co-brand things or just use some of their stuff if it fits for our work. And then they also had a few folks, they go to the National SHOT Show, which is a convention for firearms retailers every year. And they've had a couple retailers from Ohio connect with them there, and they have actually referred them back to us so that when 273 goes through, we'll be able to onboard them to be able to do safe storage at their shops. So we've been connected with them, and I would say, intend to continue that partnership after 273 gets through the full process and becomes a law.
Actually, I just got a text that Senate Bill 273 was passed out of committee and will be on the full House floor for a vote today.
Awesome.
Wow. Live by the minute
Yeah.
advocacy update. We love that.
Breaking advocacy.
I'm gonna need to get a new slide for breaking advocacy news. All right. I don't see any other questions. Matt said, not a question, just great updates as usual. So you're welcome, Matt.
Thank
We
you.
appreciate your support. And if you would like to join us again, we'll be back again next month on the second Tuesday, again at 10:30. So July 14th is the date. If you would like to go ahead and scan that QR code to register. You'll also get a link to some of this information that we have presented today, including the updates on how to register for the various things that we talked about, as well as the slide deck. So if you have any other questions or any other final words, Tony and Daniel?
No, just thank you so much for what you're doing. Make sure that you are, talking to your decision makers. Again, advocacy is education. If you talk about what you do, you're not, talking about bill numbers and all this other kind of stuff. You can talk all day long. That's what your job is, to educate. So, we just appreciate you. Go out and be a voice, and that's what I got, Daniel.
I think you summed it up perfectly, Tony. The only thing I'd add is it doesn't have to just be at the legislative level. It could be, at the state level, it could be city councils, could be school boards, could be your mayor's office. We can advocate at all levels if we want to see change. And your local suicide prevention coalitions are a great place to connect for some of that work.
All right. Wonderful. Well, thank you, gentlemen, and thank all of you for joining us today. And we will see you back here on July 14th.